Let's start by looking at the anatomy of a dental implant. So when we're looking at implants, and as we know, implants are very, very common these days when there's a missing area, missing tooth. Implant is probably the number one choice because it tends to be very successful and it has a great longevity, so it lasts a very long time. So this is your implant body. That is the first part that's done when you get an implant done. Then after a while, they'll put an abutment, which is just protrudes out. So this one just protrudes out of the gum. And then once everything's healed nicely, they'll put the crown on top. So what do we need to know about the implant? Well, let's look at some terminology. What does peri-implant tissue mean? Peri means around. So peri-implant tissues are is basically saying the tissues around the implant. Now, when we're looking at an implant carefully, okay, so here's the implant, and here is the gum, and here's the bone. My question to you is, where do you tend to see more inflammation? Do you tend to see more inflammation in the implant area, or do you tend to see more inflammation in a natural tooth area? If you said the implant area, you would be correct. This is because what happens is bacteria and plaque or bacteria, periodontal pathogens, really, bacteria can destroy the bone faster in a dental implant situation compared to a natural tooth. Why? Well, in a natural tooth, we have the PDL, we have the periodontal ligament fibers, we have the cementum, but we don't have cementum and we don't have the PDL helping us over here, and that's why it can destroy faster and the implant can fail. So it's so important for us to educate our clients on the importance of keeping our implant clean so that our implants can stay in the patient's dentition for a long period of time. And of course, when the implant fuses with the bone, so when the bone and the implant fuse together, that is known as osteointegration. And for successful osteointegration to happen, we want to make sure that the tooth is not mobile, there's no loose teeth where the implant is, there's no inflammation, there's no pain, and there's no additional bone loss. We can have 0.2 millimeter of bone loss after the first year of implantation, but after that we should not see any more bone loss. So these are all the requirements for a successful osseointegration of implants. Now, what's important to note is that the new AAP asks us to look at the peri-implant tissues, to look at the tissues around the implant. If the implant is healthy, we're going to check off peri-implant health. But if it is not healthy, if the gums surrounding the implant is not healthy, it could be peri-implant mucositis, also known as peri-implant gingivitis. And what does that mean? It basically means that the tissues around the implant, peri means around, the tissues around the implant is inflamed. No bone loss, right? Because mucositis is just like gingivitis, so there's no bone loss around the implant. So here's an example of peri-implant mucositis. We do see inflammation, but when I take radiographs of this dentition of this mouth, of this oral cavity, I notice that there is no bone loss. So this first person would have this diagnosis, peri-implant mucositis. There's red tissues, there's definite swelling. I probably would definitely see bleeding if I were to probe, and maybe the probing depths would be a little deep. The other one is peri-implantitis. This is just another word of saying periodontitis around an implant. So peri-implant mucositis is saying gingivitis around an implant. Peri-implantitis is saying there's periodontitis, or there's bone loss or attachment loss around the implant. So this is an example of peri-implantitis or periodontitis around an implant, and that is noted by the significant bone loss that we see. And this is like vertical destruction or vertical bone loss that we see. Now, sometimes when you're looking at an implant, you might see excess cement that hasn't been removed by the dentist. That could be a concern, and that can cause and aggravate more bone loss. So look at the radiographs, and if you see excess cement, we know that this cement needs to be removed because this cement is aggravating or causing further bone loss. Okay, now let's look at how we should monitor our clients that have implants. So when we have clients with implant, we want to probe them, and I'm going to go over probing as to when we should probe. We want to check for bleeding, we want to check for any pus, and we want to take radiographs. The dentist should probably prescribe radiographs every year to monitor their bone level. So probing we would do, and again, check with your schools, because sometimes schools will not allow probing around implants, so it depends on on the school. But what I'm going to go by is by the textbook. The textbook says that if you are probing, wait 3 months, wait till the tissues are completely healed. So after the implant has been inserted, wait 3 months, and then probe, because you don't want to risk bacteria going in and just making it and aggravating the tissues. So you could either use plastic probe or you could use metal probe. Just use light force. But 3 months after the implantation has been inserted, until the tissues have healed. What you sometimes can happen is you could have 4 millimeter pockets, so deeper than 1 to 3 millimeters, which is okay for implants. Just check their radiographs, make sure there's no additional bone loss. And here we can see a plastic probe. So sometimes you can use plastic probes, sometimes you can use metal probes. They used to say that only use plastic probes, but now new research has come out and said that the metal probes are just as safe. Now, how often should you see clients with implants? Well, you want to, on the first year when they get implants, you want to see them every 3 months. The reason why is because it's so important to keep that implant clean. It's so important for us to educate our clients to keep that implant clean, because if we don't, think about it, the patient's paid so much money for that implant, and we don't want that all to go to waste, right? So we need to do our part by educating our clients, and the client needs to do their part by keeping it clean. So every 3 months for the first year. And then after that, if it's stable and if they're, taking great care and there's no further risk, then we can see them every 6 months. But for the first year, definitely every 3 months. In terms of radiographs, what you'll notice, dentists will definitely say, take a radiograph of implant at least once a year, at least, because we want to make sure that we're not seeing any more bone loss. If we do see a lot of bone loss with implants, then this person has peri-implantitis. Peri-implantitis is just like periodontitis around an implant.